Right, here we go. Here's the chapter on the assessment of the respiratory function. We will briefly review some of the anatomy and physiology related to this area. This is going to be review, so from A and P. We have two tracts. Upper respiratory tract warms and filters the air. Lower respiratory tract, or the lungs, accompanies the gas exchange. So it accomplishes gas exchange there. Together, they deliver oxygen to our tissues, and they also expel carbon dioxide waste from the body. They work in conjunction with the circulatory system. Here's a picture of the respiratory system, and you'll notice the top right picture is showing you the alveoli, right? And that's the most important structure of the lungs. Listed on this slide are the structures of the upper respiratory tract. Again, no need to memorize this information. This is just to have an overall understanding. Here are the structures of the lower respiratory tract. And I would know the information under the alveoli, right? So the alveoli is where the gas exchange takes place, the diffusion of oxygen and carbon dioxide across the capillary membrane. And more pictures of our lungs. Obviously, this is the functions of the respiratory system: to take oxygen to our tissues and get rid of carbon dioxide, take the carbon dioxide to the lungs to be breathed off as waste, provides respiration as well as ventilation, and pulmonary diffusion and perfusion across the body. Thoracic cavity is an airtight chamber. Your diaphragm is the floor of this chamber. Inspiration is the contraction of the diaphragm. That's when there's movement of the chamber floor downward. And contraction of the intercostal muscles increases the space in your thoracic chamber, right? Lowering the thoracic pressure, negative pressure. Air enters the airway and inflates the lungs. And then we have expiration, which is the relaxation of the diaphragm. So we have the movement of the chamber floor upward. We have relaxation of our external intercostal muscles, increasing intrathoracic pressure, causing a positive pressure, and air will exit the airways, deflation and elastic recoil of the lungs. So there you go, breathing in and breathing out. Little review from A and P. Perfusion is when oxygen crosses the alveolar capillary membrane into our arterial blood by diffusion. You need to know that. Perfusion carries oxygenated blood to all body tissues. O2 diffuses from an area of higher partial pressure to an area of lower partial pressure. O2 is transported to the cells of the body by combining with the hemoglobin in the plasma proteins, RBCs. This combining is called oxyhemoglobin, right? A little bit from A and P too on that last note. Carbon dioxide is the end product of metabolic combustion. CO2 crosses the alveolar capillary membrane into venous blood by diffusion as well. Perfusion carries deoxygenated blood back to the lungs. CO2 diffuses more easily than O2 across the alveolar capillary membrane. So here again is a picture of what we just talked about, okay? Diffusion of CO2 and O2. Again, so gas exchanges, literally what we just talked about, functions of the respiratory system. This is another picture of the gas exchange within the alveoli. And when we're doing our comprehensive respiratory assessment, we already talked about this in the other video. These are all the things you're going to collect. I'm not going to cover it again because it's in the other video. We are definitely looking at past medical history, social history, family history. Childhood illnesses are really important. Immunizations, diet and exercise is important. And then, of course, risk factors, including genetic ones, right? Definitely going to do a physical assessment of your patient. You're looking for, looking at the left and right side. Do they rise and fall equally? Do you have any of barrel chest, clubbing of the fingers? Is there any cyanosis to the skin? Is there any, airway strictures or any kind of examination of the upper airway problems, right? Lower respiratory structures, you want to inspect, palpate, percuss, you want to definitely listen, right? Let's see. Oh, and this is just a reminder from the physical assessment when we did it in lab. Look how you're comparing one side to the other. And then when you're doing your full lung assessments, just like we talked about in lab, you don't go as low as you think you need to when you're listening to the lung. And I'll show you on the, oh, here's the back picture too, right? When you look at the back, it's the same, right? It's about the same amount right where the ribs end, right? It's kind of hard to picture how far the lungs go down, right? But this picture is really good because it shows you the scapula, and here is where the rib cage ends, right? So you're literally making sure that you're comparing, again, one side to the next, all the way at the top, all the way down. And remember, on the back, you go, because of the scapula, you have to listen, like I said in lab, in a C formation, right? So you start here and you kind of go like a backward C. Oh, same over here. Oh, sorry. Good grief, you guys. My apologies. Same thing. Backward C there, right? So again, we're going to auscultate anteriorly, posteriorly, and laterally. We're going to listen for normal lung sounds, any adventitious or extra lung sounds, and then any voice sounds. And make sure you're doing in the proper sequence where you're checking one side and comparing it to the next, okay? And then these final slide is the pulse oximetry that will tell us the patient's SpO2 and heart rate, right? And we've been using these in clinicals. So hopefully that's it. All right, that's this section. This is the end of this chapter.